Thank you for your presentation and sharing your experiences and the experiences of your family and your community, Lorene. So now we'll be moving into the panel discussion with our Region 2 speakers. I had a question to start things off here. Lorene, this might be more for you, but Tracy, I'd be curious to hear what you think as well. Based on your experience, what do you think are the best ways to support the training of physicians to prepare them to address PFAS-related questions and concerns in PFAS-affected communities? And related to that, and this is something you touched on, Lorene, I'm struck that residents of impacted communities who spend considerable time learning about these chemicals and their health effects are often more familiar with PFAS than their doctors and other medical professionals who need to stay current on a broad range of topics. So how can we support knowledge sharing between patients and clinicians? And how can clinicians be supported in getting up to speed about PFAS exposures and related health effects?
I believe that state departments of health need to be fully involved with ongoing training sessions, perhaps, as I mentioned, offering education credits to those doctors to participate in learning, especially in contaminated and around contaminated communities. Specialists out here in Albany, which is about an hour from here, they don't know, and they're specialists. But I think the State Department of Health really need to buckle down and start offering training and learning any way they can.
Yeah, Laurel, I would just add to that, certainly agree with Lorene. And here in New Jersey, our Department of Health does have excellent epidemiologists, and DEP has toxicologists that are top notch. But I also think there needs to be federal guidance. And one of the big issues seems to be, at least to me looking at it from New Jersey's perspective, that not every state is created equal in terms of the resources that are put into to the health agencies. And so we really need to have the federal government step up so nobody's left behind because that investment is not made at the state level. I do believe we need to advocate from the bottom up, make sure we have those resources. And there are ways to do that, but we need federal support, federal funding, and then also, through the training that health professionals are required to do regularly and they get credits for, they should offer those sorts of trainings that they would get credit for. So then it does make it possible to fit it into a busy schedule, for instance, for a medical institution.
Okay, great. Thanks to both of you for sharing those responses. I'm not seeing any questions yet from any of the committee members. I'll ask another one. Oh, Chris, go ahead.
I guess this is for either Tracy or Lorene. You've made it clear that, as have the other speakers, that data is desperately needed and a comprehensive data set from which decisions could be made, whether those are regulatory decisions or medical guidance decisions. But I wonder in the short term, and you can define short term, you all have been at this for a number of years, and you're obviously frustrated with the lack of speed with which things have happened. And what's your impression of what does the community need in the short term while these questions can't all be answered? Because we can't make definitive statements yet about a lot of direct cause and effect of exposure and disease. But what are the things that could be provided to provide guidance to communities so that they can have enough information to either take action or at least feel comfortable that they have some idea what the potential risk is?
Two things pop up to my mind immediately. The first is stopping immediately, as soon as possible, continuing exposures. It just has to be, or we're just never going to get ahead of this. And the second is, at least with the knowledge that we have, whether it's from the CE science panel or not, basic tests done. So like on my grandchildren, for instance, immediately their test was for thyroid function, kidney function, liver function. Then we went on to, like, for instance, I had to have they found lumps on my thyroid from one of the tests my physician sent us on. So because there's so much of a range of issues now being linked, it's hard to narrow down some. But we gave a good example of here how we started how we got a kickstart on how to start testing, what tests to look for. Even though they were basic and simple, it was a start. So starting them off is important.
Tracy, anything else?
Yeah, I would just add that totally agree. I mean, stopping the pollution is number one. But also we need to get it out of drinking water. So there needs to be maximum contaminant levels for PFAS compounds, and it needs to be mandatory that it be removed from drinking water. That's the largest mode of transport, of exposure for people, and we have to get it on top of that nationally. And then I would also say we have to make the polluters accountable, because they have deep pockets. They're the ones who've been making millions, billions, trillions off of these compounds for decades. And it is absolutely essential that they step up and pay for this. So that also takes effort on the part of the states, and I would hope on the part of the Attorney General for the United States as well. And then also, I think blood work, even though you may not have all of the medical answers together, the blood work is really important in order to get that baseline information. There wasn't blood drawn early on enough, probably anywhere, but I know that didn't happen in New Jersey, and they did use blood banks and that use some information from the past, but you can't do health studies associated with that blood. So it's really, really important that there be blood drawn, and that effort to be done right away, even if you don't know what the answers are associated with how the levels in the blood or the concentrations in the blood affect health.
Thank you.
Okay, thanks. Laura, you got your hand raised.
Thank you. Great presentations. I happen to be co-director of a regional center called the Pediatric Environmental Health Specialty Unit, which is national. We actually train doctors and nurses and other health professionals around PFAS. We have for 7 years now. But we've had, in some areas, a lack of interest, or like, well, we're already screening pregnant women for blood pressure problems, so what's new? What are either of you can answer that? What are your thoughts about, and we're funded through the federal government, through CDC and EPA. What are your thoughts around these centers partnering with community groups to possibly mobilize or encourage primary care providers to learn more about this? That has been an issue over time.
Now that we have one, which was formed from our Superfund status, we've been doing some great work over the last 2 years. We'd be more than happy to discuss this with you and partner up. Again, as we're going to be starting our multi-site study soon, so we can get that information out there, as we're going to have to do that for this as well. So the timing would be enormously important to do so.
Absolutely agree. And I think one of the most important missing pieces in a lot of communities is a lack of trust. It's a lack of trust of those who are in the government, a lack of trust of companies, and there's just not a lot of rapport that has been developed, and all for good reason. And I think building that trust is really important, and one way to do that is open and frank discussions, even when you don't know all the answers. It's most important to talk about it than to hide it, because you don't want to cause a furor or a panic. We were told many times, you're just being sensational. You're getting people all upset. Well, you know what? Yeah, people need to get upset, and then we'll deal with it. But when there's nothing happening, then you're acting as if ignorance is bliss, and it really isn't. It's hurting you.
Communication is absolutely dire, vital, and essential. And again, I don't know how many of you heard the story here in Hoosick Falls. How it started was our Department of Health knowing our water was contaminated for almost 1.5 years and never told us. That came out in state hearings and whatnot. It was the EPA who came in and issued a do not drink order. So and again, as far as trust goes, well, that didn't help. And then all the, debacles that followed. But yeah, and even with doctors now, communication is key. I'm so tired of doctors in the area not listening to us at all. I've had several look at me frustrated and say, well, and just keep referring to lead. They're not hearing the words, you break molars. I can tell you that you break molars without a doubt. I have broken many now. But again, lack of communication, lack of awareness, lack of communication.
Great. Thanks for your question, Laura. I had another question. Both of you have talked about the importance of blood testing for your communities for many reasons, including setting a baseline. Currently, there is no single benchmark for PFAS chemicals in the way that we have for long established health hazards like lead. So what additional information have you found most helpful, or would you recommend to support residents of impacted communities who are trying to understand and interpret the results of blood testing and biomonitoring? Sometimes we hear that community members are told that looking at your PFAS levels might be upsetting. There's no guideline, and it's maybe more important to look at a community level rather than an individual level. So for people who are doing that report back, what guidance or suggestions would you have to help residents?
I can assure this whole panel and committee that getting those numbers is not as frightening as not knowing them. It's akin to being told, well, you have cancer, but then never getting a test for it or never getting a result from it. You're in limbo. Knowing is better 100 times over. Because then you can make an informed decision on how to proceed with your family. So blood testing should be offered to those sites that have been knowingly contaminated. It's peace of mind. And we are not alarmists. Trust me, we've been going through this for so long. It's just medical knowledge for your family.
I think also knowing how you compare to the NHANES numbers, for instance, is important. And if a community has levels or concentrations of PFAS in their blood that's greater than the general population, then there's cause for concern. And it shows that they have been exposed at a greater level than others. So I think that in itself is important. In terms of the medical aspects of that, I really can't address it, but I do know that we need more epidemiological analyses to be done. We need more comprehensive, holistic monitoring done after exposure, and then studies that are designed by epidemiologists in order to understand, how this individual fits into the community, and then how the community fits into the national picture.
So,
Great. I'd like to thank Tracy and Lorene for their presentations and for an informative discussion. I think Ned's hopping on here to let us know that our session is wrapping up here, and I think we're heading into a break.